I see my friend and colleague from Wyoming who just spoke on the floor is still in the chamber. And I want to acknowledge publicly, I hope he will too, we're friends. We disagree on the nomination of Dr. Vivek Murthy to be our next Surgeon General. And I'd like to speak for a few moments about why I'm supporting him and why I hope a majority will join me in support of his nomination. This is an indication of what can go wrong in the Senate. We received this nomination from the President of the United States to fill this post of Surgeon General, reported from committee in February of this year. Obviously, we're in December. It's been sitting here since February. In fact, the post of Surgeon General has been vacant since July. Surgeon General was supposed to be the leader, one of the leaders in America, speaking to issues of public health. Can anyone think of a public health issue that we've had to face since February, when Dr. Murthy was reported to the floor of the United States Senate? Perhaps one of the deadliest diseases that has ever been recorded is being fought in West Africa, and we are being asked on a regular basis how we will respond in the United States. The Center for Disease Control plays a major role in it, but historically, surgeons general have played a major role when we face similar public health challenges. I can remember coming to the United States House of Representatives years ago when President Reagan had been elected, and he had chosen C. Everett Koop to be his Surgeon General. C. Everett Koop was a controversial choice by President Reagan because he had been outspoken on some major political issues. He personally had strong feelings against abortion and had said as much before his nomination, and some other issues. And it led many people to believe that he was too political for the job and that President Reagan had made the wrong choice. But Koop was chosen despite the fact that he had been at least engaged as a medical doctor in discussing political issues. He was chosen. I wasn't in the Senate at the time. I didn't have a vote when it came to his choice. But I will tell you this, when Dr. Koop took over as Surgeon General, he made it clear that he understood that his obligation was to be the nation's doctor, not the nation's leading medical politician. He did some extraordinary things. I don't know what America would have been like if it were not for Dr. Koop's presence, pushing back on a lot of political spin when it came to public health issues, issues involving AIDS, for example. It's no secret, it's well known, that many politicians, in both parties for that matter, were reluctant to go into the whole issue of the AIDS crisis in America for a variety of reasons. But if you will remember, history shows that under Dr. Koop, we ended up mailing every household in America to let them know about the danger of the AIDS epidemic. That was an extraordinary act of public leadership when it came to public health. And Dr. Koop was Surgeon General when that occurred. So those who worried that C. Everett Koop was just too political for the job were disabused of that notion as we watched his service to our country. I make that point because I don't want the same mistake to be made in criticizing Dr. Vivek Murthy, who we're going to vote on later today to be our next Surgeon General. It is true that he is engaged in political activity, as any American citizen is entitled to. I hope that would not disqualify him. When I read in a few moments the groups that are supporting him, you'll understand that he isn't in this position of being nominated simply because of his political activity. He has an extraordinary backing of individuals in the medical profession. Now we need him more than ever. We need to fill the post of Surgeon General of the United States of America. We hope that we can see an end to the Ebola epidemic. We're not quite there. But we ought to have a Surgeon General in the United States of America. To think that we have waited since February while this doctor's name has been on our calendar, and we had to use some extraordinary parliamentary moves to even bring his name up for a vote here, I think it's time for us to vote, and it's time for us to confirm the nomination of Vivek Murthy as our next Surgeon General. This past year, Americans have battled public health crises on all fronts. Here at home, parents watched while a severe strain of enterovirus spread from state to state, threatening young children. Illinois, my home state, was one of the hardest hit. I heard from doctors across the state that the minute they discharged one child with respiratory symptoms from the emergency room, another came in. Abroad, we still face the worst Ebola epidemic in history. With over 6,300 deaths and many more diagnosed with this devastating disease, now more than ever, America needs to fill the spot of top doctor. It has been vacant since July. Since July. Dr. Vivek Murthy is that doctor, and I'm proud to vote for him as the next U.S. Surgeon General. I'm hoping my colleagues will join me. Let me tell you a little about his background. Dr. Murthy is an attending physician at Brigham and Women's Hospital, an instructor at the Harvard Medical School. Part of what's extraordinary about him is that as well as treating his patients individually, he also thinks about the systemic issues affecting the health of patients and tackles those as well. He is a leading voice in public health, publishing his research on the participation of women and minorities in cancer clinical trials in top journals, including Science, Journal of the American Medical Association, and Journal of the National Cancer Institute. Critics of Dr. Murthy, who say he's not up to the job, should just look at the literature. He is published in medical research areas of great importance. He also co-founded and chairs the Trial Networks, a software company that helps clinical researchers collaborate more effectively and efficiently with drug developers to speed up drug discovery. In 2011, Dr. Murthy was appointed to the advisory group on prevention, health promotion, and integrative and public health. Over 100 national, state, and local public health organizations have endorsed his nomination. They describe him as, quote, a well-qualified, forward-thinking, innovative leader with a strong commitment to public health, end of quote. Does that sound like a political hack when 100 organizations say that about this doctor? The organizations that support Dr. Murthy include the American College of Physicians, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Public Health Association, the American Hospital Association, the American Cancer Society, the American Heart Association, the American Diabetes Association, and the list goes on from there. In his confirmation hearing before the Senate Help Committee last February, Dr. Murthy stated, if confirmed, he would prioritize his efforts on obesity and tobacco-related disease and, quote, make prevention and health promotion the backbone of our communities. This is something that I share with Dr. Murthy. For the past 30 years, serving in the House and Senate, I've worked on the issue of tobacco and public policy. I've worked to reduce youth smoking, implement programs to help people to quit, and rein in the most insidious practices of the tobacco industry. Moreover, I've chaired as a co-chair of the Senate Hunger Caucus, I've become familiar with the complex and arguably unjust way food is distributed and consumed in America, leaving communities, including many in Illinois, simultaneously facing high levels of food insecurity and high rates of obesity. Obesity and tobacco-related diseases are a part of a growing trend of chronic disease that claims 7 out of 10 deaths in America and makes up 86% of America's health care cost. Dr. Murthy says these are his priorities. They should be. These statistics are unacceptable. I believe Dr. Murthy understands the importance of the national crises before him. I feel confident that his experience, his training, and his tenacity have proved him that he has qualifications that are needed to tackle these issues. Not only is Dr. Murthy an outstanding doctor and public health expert, but he also remains closely connected to his community and family. Dr. Murthy was born to parents who originally were from the southern part of India. He came to the United States at the age of 3 and grew up in Miami, Florida. He did very well at school. He was valedictorian of his high school, graduated magna cum laude from Harvard in just 3 years, and then got a combined medical and business degree from Yale. So senators who come to the floor and question this man's resume, his ability, for goodness sakes, he has an extraordinary background, and that's why the president nominated him. From a very early age, Dr. Murthy did not set out to make money. He set out to make a difference. In 1995, he co-founded Visions Worldwide, a nonprofit organization that conducts and supports HIV/AIDS education and empowerment programs in India. Until 2003, he served as the president of that organization and then board chair. He's a dedicated uncle and friend, consistently described by those who know him as humble, soft-spoken, and tireless. I know the Indian American community across this nation is so proud of Dr. Murthy's accomplishments, as all of us should be. Madam President, many years ago I worked for a state senator in Illinois named Cecil Partee. Cecil Partee used to say, for every political controversy, when you listen to the arguments, understand there is a good reason and a real reason. What is the real reason for the opposition to Dr. Murthy? It may have come down to just one thing that he said. It was alluded to by the senator from Wyoming earlier. During the course of his hearing, he said that he believed that gun violence was a public health issue. Gun violence, a public health issue. For making that statement, he has been pilloried and excoriated by the gun lobby, and that may be a major reason why his nomination is controversial. I'm proud to represent the city of Chicago and the state of Illinois. Gun violence is a public health problem. Go to the emergency rooms, and I'll give you the list of the names of hospitals in Chicago to start with. Go to the emergency room on a Friday or Saturday night, and you tell me that gun violence isn't a public health issue. In those emergency rooms, you will see the victims of gun violence, many of them fighting for their lives. If you go to Mount Sinai Hospital in the Englewood section of Chicago, you can look across the street to a rehab institute. Those who have survived gun violence at Mount Sinai go across the street to the Schwab Rehab Institute and learn how to live a life as a paraplegic or a quadriplegic. Does that have anything to do with public health? It certainly does. Gun violence is a public health issue. No apology necessary. But I think Dr. Murthy, like Dr. Koop, has made it clear they're not aspiring to be the leading doctor in America to engage in a political debate, but rather to engage in public health debates about obesity and tobacco and things that make a dramatic difference to the lives of so many people who live in this country. I'm supporting Dr. Murthy. I think he'll be an extraordinary Surgeon General. I'm sorry that he and America have had to wait so long for this vote. I hope a majority of my colleagues will step up and support his nomination as well. At this time of challenge, when it comes to public health issues, we need his leadership. We need his expertise. We need a person of this quality as Surgeon General of the United States.